Welcome, everyone. We're so glad you've joined us for today's webinar, Community Health Worker, Promotor, and Community Health Representatives, Updates, Opportunities, and What's Ahead. My name is Kussy MacKenzie, and I'm the Director of Strategic Initiatives at Health Leads, and I'll be serving as today's moderator. Next slide, please. Before we get started, we have just a couple quick technical instructions. To listen to this webinar in Spanish, please click on the globe icon at the bottom of your screen to select Spanish. Mute original audio if you hear two voices. Everyone, including English speakers, must select a language to ensure a smooth interpretation experience. If you would like to view slides in Spanish, click the Spanish slides at the top of the Zoom screen. Everyone, including English speakers, must select a slide deck language to ensure a smooth experience. You can also turn on closed captioning by clicking the CC icon and choosing Show Subtitles. I'm going to drop the instructions in the chat. Okay. All right. Para escuchar este seminario web en español, haz clic en el icono de globe en la parte inferior de tu pantalla. What's that? Okay. Para escuchar este seminario web en español, haz clic en el icono del globo en la parte inferior de su pantalla de Zoom y selecciona español. Silencia el audio original si oyes dos voces. Todos, incluidos los hablantes de inglés, deben seleccionar un idioma para garantizar una experiencia de interpretación fluida. Si quieres ver las diapositivas en español, haz clic en diapositivas en español en la parte superior de tu pantalla de Zoom. Todos, incluidos los hablantes de inglés, deben seleccionar un idioma de la plataforma de diapositivas para garantizar una experiencia fluida. También puedes activar los subtítulos cerrados haciendo clic en el icono CC y seleccionando Mostrar subtítulos. And I'm going to drop those instructions in the chat as well. Oh, I guess I can't. All right. So the speakers, including myself, will do our best to speak clearly at a steady pace to help create a quality audio experience for our attendees listening to the webinar in the Spanish channel. Javier and Daniel are interpreters today from Let's Lingua Court Interpreters. We want to acknowledge Javier and his team for supporting us for the last 4 years in making all of our events and materials bilingual, thus more inclusive. Mil gracias. Next slide, please. Welcome again to the Community Health Worker, Promotor, and Community Health Representative Updates, Opportunities, and What's Ahead. Today's webinar is part of the Amplifying Impact Initiative. Through this initiative, we're highlighting local successes, sharing workforce tools, and offering high-impact technical assistance to help organizations grow and sustain their community health worker integrated Medi-Cal program efforts. This work is made possible by the California Healthcare Foundation with additional support from Cedars-Sinai. Here's what we'll cover today. After the welcome, we'll be going into the Community Health Worker Resource Center. Then you'll hear updates around the Community Health Worker Training Program Best Practices Framework, as well as Pillar 2 updates, which is around the next iteration of the Amplifying Impact Initiative, before going into a question and answer session. Next slide, please. Before we begin, I want to take a moment to ground us in a land acknowledgement. I'm joining you today from St. Paul, Minnesota, which is the native land of the Dakota people. I honor their enduring connection to this land, past and present, and recognize the strength, resilience, and contributions of Indigenous communities across the country. In the chat, we invite you to introduce yourself, where you're joining from, and the name of the Indigenous nation whose land you're on. You're welcome to share how you acknowledge or take action and honor that land and those people. We'll try to drop a couple links in the chat to help you identify the native land you're on if you're unsure. If you'd like to view the English slides, look at the top of the screen and you should see an option for Spanish screen or English slides. So that's where you can choose to view the whatever language you want to view the slides in. Next slide, please. The practice commitments that you see here have been adapted from our Health Leads culture. Our best practice is start meetings by pausing on these commitments to center our conversation and set intentions for our actions in this conversation. The commitments we develop these commitments to facilitate better, safer, and deeper dialogue. These commitments are to be present, brave, and curious, create an inclusive space, invite anti-racist dialogue, and be accountable. Now we'll pause for a minute to center these commitments. During the pause, folks are welcome to uplift certain commitments in the chat. All right, next slide, please. All right, this is the third webinar of the Amplifying Impact Initiative. Today, we're exploring recent policy shifts and statewide initiatives that are shaping the future of the healthcare workforce and the communities they serve. Joining us to debut the new best practices framework for community health worker training programs are Libby Abbott, Deputy Director at the California Department of Healthcare Access and Information, and Lalitha Vaidyanathan, a Senior Advisor at the Center Consultancy. We also have Joe Lee, Founder and Principal Consultant at Community Health Synergy, facilitating our audience question and answer session at the end of the presentations. To get us started, I'll turn it over to Logan Kelly, Senior Fellow at the Center for Healthcare Strategies, to introduce the new Community Health Worker Resource Center. Logan, the floor is yours.
Thank you so much, Kussy. I'm very excited to share information with you all today about the just launched Resource Center, building and sustaining CHW PR programs in California. I'll describe how it features examples and tools developed by CHW PR stakeholders across California, and then how it can be used to help manage care plans, providers, and community-based organizations to deliver CHW PR services funded through Medi-Cal. So we can go to the next slide. And I will start with, and then you can go one more slide. I'll quickly share just a little bit of information about the Center for Healthcare Strategies. We are a national nonprofit working with stakeholders across the country to strengthen healthcare services to ensure better and more equitable outcomes, particularly for children and adults served by Medicaid. So in our work, we identify and advance best practices, provide technical assistance, training, and tools, and then spread success by connecting peers and experts across sectors. And we've supported a wide range of initiatives focused on CHW PR programs in states including California. And many of these initiatives have emphasized program sustainability and engaging CHW PRs to inform program design. And there's a little bit more about CHCS here, but in the interest of time, I'll move on to really spotlight the Resource Center that we are so proud to have helped to launch. So we can go to the next slide. And just to share a little bit of history. So back in 2021, the California Healthcare Foundation published a Resource Center designed to support managed care plans, or MCPs, and their partners to expand access to CHW PR services for Medi-Cal members. In the last 5 years, we know that a lot has changed. That includes the launch of the Medi-Cal CHW benefit, Enhanced Care Management, or ECM, and community supports. And there's been major growth in CHW PR programs and so much knowledge generated among stakeholders across California about what best practices and tools can help these programs to succeed. And so, building off that growth, the Center for Healthcare Strategies partnered with the California Healthcare Foundation to revise that original guide. And then just last week, we launched the new Resource Center, which is full of practical resources, guidance, and tools to build, manage, and sustain the CHW PR workforce. The main intended audiences for this resource center are California managed care plans, providers, and community-based organizations that employ CHW PRs. And to design this resource center, we first engaged stakeholders across the state through surveys and interviews to just find out what resources were most needed. And the priorities that we heard really shaped the design and focus of the resource center. And just as one example, we heard that curation is really important, and to include a select number of resources that are especially comprehensive and user-friendly, rather than including a larger number of resources that may make it more challenging to navigate. We then invited stakeholders across California to submit resources and tools that they've created or that they recommend and that they found to be really valuable in their work. And just in the chat, I can see a number of individuals and organizations that submitted ideas and submitted the tools that they've created, which we immensely appreciated. Our team applied a set of inclusion criteria as we evaluated all of those resources. We also did a comprehensive scan for resources created both in California and nationally. And we identified approximately 80 resources to publish to the Resource Center. They're mostly specific to California, but some are national resources that we think really have significant relevance for California audiences, and that we received recommendations on from many California stakeholders. And again, I want to just extend our deep appreciation to everyone who submitted suggestions and shared your work with us. Those ideas that we received shaped the structure of the Resource Center. They shaped the topics that we focused on, and then all of the specific examples of tools that can be found on it. So we can go to the next slide. And I'm not keeping up with the chat, but I'll just note that I'll make sure at the end that there is a link to the Resource Center, and we'll make sure that everyone has that to navigate there. So the Resource Center is organized by the topics on this slide. First, evidence and case studies of how CHW PRs impact the communities that they serve. So this includes a lot of resources to help communicate the value of CHW PR programs. The evidence and these case studies are so robust that in addition to featuring individual resources, we also created some summary tables on research studies, as well as a summary of case studies to help users navigate the many, many resources that are available here, and that hopefully can help you communicate the value of these programs to your internal or external partners. Next, we have CHW PR services in Medi-Cal programs. And this section focuses on services that are reimbursed by Medi-Cal. It focuses on the CHW benefit, enhanced care management, community supports, as well as dental CHW services and enhanced CHW services. And this section includes a number of resources published by California's Department of Healthcare Services. The next section gets into contracting and billing. What are the requirements to receive reimbursement through Medi-Cal? And then how to expand the provider network for these services from the perspective of managed care plans. Then we have recruitment, supervision, and integration of CHW PRs, and I'll come back to that section in just a moment. There's also a section on training for CHW PRs, as well as CHW PR supervisors and on organizations that CHW PRs work within or partner with. This includes manuals, directories, and tools to support CHW PR training that's aligned with Medi-Cal benefits. And then finally, we have program measurement and financial sustainability. And these are resources to evaluate programs and support financial planning for employers as well as managed care plans, engaging providers. And so when you go to the website, you'll see these topics are listed on the left. You'll be able to check a box to filter the list based on these topics. You can also filter by audience, and so that includes CHW, PR employers, and managed care plans, and also filter by the type of resource, whether that's a tool, provider manual, webinar, or other. So on the next slide, I'll share a couple of examples of just the range of tools that you'll be able to find on a specific topic. Right here on this slide, um, on recruitment, supervision, and integration. The breakdown is we currently have 22 tools that are designed to support organizations to recruit and supervise CHW PRs with varying levels of professional and lived experience and integrate CHW PRs within care teams. So a couple of these resources. The first is examples of CHW PR job descriptions. Many of you, I can recognize from the chat, contributed examples for this, which we immensely appreciated. We know there's just so many excellent examples of job descriptions that are out there. We didn't want to include just a couple, so we created a guide that really highlights different areas of focus among those job descriptions, different skills, different populations of focus that we hope will be valuable for stakeholders. And I'll highlight just a couple of the organizations featured there, San Diego Wellness Collaborative, Visioni Compromiso, Aliados Health, Bay Area Community Services, the San Francisco Community Clinic Consortium, as well as many others. And there's also some really great high-level guides and templates on how to design job descriptions that organizations have developed as well. Next, I'll highlight the Community Health Worker Framework of Northern California and Self-Assessment. This is a resource that was developed by the Sonoma County Department of Human Services, which describes a consensus-driven approach that can be used to develop the role, scope, training, recruitment practices, and program design for a CHW program. Next, an evaluation toolkit for CHW supervisors. This was developed and published by the CHW Learning Hub, which I will just call out, has many, many extremely valuable resources as well, all available in English and Spanish. And then finally, just one last example from this section is a national report from the Network for Public Health Law, which is about overcoming legal obstacles to hiring formerly incarcerated individuals as CHWs. And it has examples of some of the key legal barriers that may be faced, and then what are the practical opportunities for employers to address those barriers. So that provides, I think, a snapshot of the kinds of resources that you can find on any one given section. And then we can go to the next slide. And I'll just call out that there's more that's coming soon. So over the next month, our team is planning to upload even more resources to the site. These include first directories of foundational training programs for CHW PRs and a directory of professional development and specialized training modules. We broadly shared the request for organizations to submit either their training programs or their ideas for these directories. We tremendously appreciated the high response on that. And so those directories should be published within the next few weeks. We'll also be releasing a tip sheet comparing the wide range of Medi-Cal funding sources for CHW PR services. A tip sheet that we'll hear more about shortly on how to apply the CHW PR training program best practices framework, and a tip sheet on evaluating and measuring CHW PR programs and activities. So stay tuned. There will be more to come over the next month. And then we can move on to the last slide that we have. And I'll just say that we know new resources are being created all of the time. This resource center reflects our work to identify the most comprehensive resources to address audience needs as of this moment in time in early 2026. We welcome suggestions. So that could include resources that you think should be considered to add to the Resource Center. We'll soon add a link on the main page to submit resources for consideration. In the meantime, our email addresses for myself and my CHCS colleague Megan Terrell are on the screen. We welcome you to reach out to us and share those ideas in the meantime. I'll say that, as I mentioned, we have a set of inclusion criteria that we apply to all of the suggestions that just helps us keep the overall size of the resource center to be easily navigable. And we want to acknowledge that the Resource Center, as well as most of the resources that it links, are in English. And people may be looking for resources available in non-English languages. When possible, we listed when resources are available across multiple languages, and particularly in a couple of tools. One are the training directories, which highlight trainings that are available in multiple languages. And then I will shortly share a link to everyone on another resource that really highlights kind of all of the resources published in multiple languages, which highlights some selected tools and resources specifically for CHW PR practice. We very much appreciate feedback on whether there are particular other resources that you would like to see translated into non-English languages and on any other language access barriers and suggestions. And I also saw some questions in the chat about the CHW Learning Hub, which is a great resource, also with extensive kind of resources in English and Spanish. And thanks, Joe, for sharing that link in the chat. So we'll be answering questions later in the webinar. If you have questions about either the process in developing the Resource Center or are curious about how to use the Resource Center or how to apply it in your work, we'd welcome any of those questions. And then if you have any questions that we can't answer today, please feel free to reach out to myself and my colleague Megan at the emails addresses that are listed here. So I think that, and I will resend that link in case that wasn't working with a different way to access that. So I think next I will introduce Libby Abbott from the California Department of Healthcare Access and Information. Welcome, Libby.
Thank you so much. And thank you for the opportunity to be here. My name is Libby. I'm the Deputy Director for Health Workforce Development at HCI, the Department of Healthcare Access and Information. We love our acronyms. I will share a little bit more about what we do as a department, but first just want to say that we really appreciate the opportunity to be a part of this conversation, to share our work, and to engage with all of you as partners and community members as we are shaping and implementing our investments. I think we can skip ahead 2 slides. We've got 2 intro slides here. Yeah, there we go. So I'll share a little bit about the department that we sit in, the Department of Healthcare Access and Information at the state. Our mission at HCI is to expand access to quality, equitable, affordable healthcare for all Californians. And we do that by supporting high-value delivery systems, resilient health facilities and workforces, and actionable health information and strategies. HCI works in 5 program areas, one of which is health workforce. And within the health workforce arena, We work in primary care, maternal health, behavioral health, nursing, and oral health. And really our goals in the health workforce arena are to expand and develop the health workforces that serve Medi-Cal members, that serve underserved communities and geographies. And we at the same time want to make sure that as we're supporting and expanding the workforce, we're developing a diverse workforce that reflects the California that it serves. We know that is important for health outcomes and for participation. Next slide, please. So I'll share a little bit about some of the work we're doing specifically in the CHW PR space. Specifically a few years ago, it was really when we first started working on community health workforce. And some of you will know that that journey has taken many twists and turns over time. But at the highest level, we're kind of focusing on strengthening the CHW PR workforce and the systems that support them. That includes aiming to expand community-based care, supporting the organizations that employ and train CHW PRs, and all with the goal of advancing health equity across California. Underlying all of this is a desire to also build the infrastructure that would allow CHW PR services to expand to communities and be sustained over time. And we do that in partnership with our sister department, the Department of Healthcare Services, through a focus on scaling the CHW PR Medi-Cal benefit. I'm not going to do a great job of monitoring the chat, but I did just see a question, and I apologize for not spelling out that full acronym. So when we say CHW PR, we mean community health workers, promotores, and representatives. So thank you for asking. It's a great question. Next slide, please. So I mentioned earlier that HCI's work to support the CHW PR workforce has taken many twists and turns over the last few years. To be more specific about that, in 2022, HCI was tasked with developing a statewide certificate program for CHW PRs. We spent 2 years working with community to determine what that should look like. And we were in the midst of a second round of deep community engagement, trying to be responsive to some constructive feedback we had received, when in 2024, there were major budget changes that resulted in us losing about $250 million for this initiative. That's pretty significant. What that meant was we no longer had the resources to design, stand up, and maintain a certificate function. So we shifted away from that original task, which was to develop a statewide certificate program. And instead we thought, what can we do with our remaining resources? What are some meaningful one-time workforce investments that we can make? Next slide, please. So following those budget reductions, we remained with about $14 million for investments related to the CHW PR workforce. We worked closely with an advisory group to develop and refine the investment framework that you see on this slide, which is now focused on 3 pillars. Together, these pillars focus on strengthening community-based services, supporting the CHW PR workforce and the organizations that train and hire them and have been doing that work historically, and improving training quality and access. So today we're going to focus on pillars 3 and 2. I'll talk about pillar 3 and we'll pass to colleagues to share about pillar 2. Pillar 3 is the best practices framework that was sent out as a pre-read for this meeting, and I'll share a little bit more on the next slide. So pillar 3 is focused on developing a best practices framework on CHW PR training. And I want to highlight at the very beginning that this is not a certification or accreditation framework. It is instead a voluntary set of recommendations. And in putting together voluntary recommendations, we are aiming to preserve the core values of the field, provide guidance that will help standardize and support CHW PR training without over-professionalizing the field. We want to make sure training is accessible for everyone, and we want to build a shared framework that is grounded in community knowledge and experience and in research. So we're bringing together sort of best practices from outside of California, from within California, but really grounded in what has worked here, What are organizations doing? What have they been doing for a long time? How do we pull together and lift up those best practices? So the best practices are meant to be a compass offering clarity and consistency about what a strong, effective CHW PR training program can do. Next slide, please. With that, I'm actually going to pass to my colleagues, Lalitha and Joe, who will walk you through some more details about the best practices framework.
Thank you so much, Libby, for sharing why the CHW PR training program best practices matter. Hi, everyone. My name is Joe Lee. I use he and him pronouns. I am first and foremost a CHW PR ally. And in more than 17 years of my community health career, I formerly worked as a CHW PR supervisor and director in both local and national initiatives. I am one of the community consultants that supported this California Healthcare Foundation supported project. And I have worked very closely with my colleague here, Lalitha, and our fellow consultants and HCI colleagues who are on this call, as well as the amazing HCI CHW PR Initiative Advisory Work Group. On this slide, I'll be explaining the process for developing the CHW PR Best Practices Framework. The development of the best practices framework was made possible through in-depth secondary research, statewide stakeholder interviews with diverse entities, and consulting support from Lalitha, who led the research, and community consultants, including Yale Ruiz, Tim Berthold, and myself. To provide a little bit more detail and context behind the process of developing the best practices framework, I'd like to start with the amazing HCI CHWPR Advisory Work Group. This advisory work group is mainly composed of active and diverse community health workers, promotoras, and representatives all across California. And I believe I see many of them here on this call. So I just want to give a personal shout out to those who are on this advisory work group or who have participated in this project. This work group gave very important input and feedback on the training best practices based on our research and interview findings from the start to finish of this project. In our secondary research, our project team reviewed recently published reports on CHWPR training in California. We studied diverse CHWPR training models and reviewed curriculum examples from the groups we interviewed. For the interviews, we conducted initial and follow-up interviews with around 40 people and groups. They included our project work group members, training programs all across California, community groups, health plans, county health departments, colleges, workforce groups, labor organizations, and tribal and urban Indian health organizations. Everyone attending this webinar and those who have registered will be able to learn both the research and interview findings in a comprehensive report, which will be published in early summer. We'd like to note that our research reflects that the groups that participated in our interviews, however, they are not intended to represent every CHWPR training program in the state. As Libby noted earlier, this best practices framework is intended as a set of voluntary recommendations, and it's not meant to be prescriptive. So we encourage you to adapt and tailor their approaches to your local context and priorities. The last comment I'll make is that this whole development process was made possible through the support of the California Healthcare Foundation, who funded this project. And I will now pass it on to my wonderful colleague, Lalitha, who I mentioned earlier, led the research portion of this project, and she'll now share the best practices framework results and categories and some of our sample highlights. So over to you, Lalitha.
Thank you, Joe. Hi, everyone. My name is Lalitha Vaidyanathan. I'm an independent consultant, and with all the folks wonderful people that Joe mentioned, help lead the research for this best practices project. So what is the best practices? So as Joe mentioned, what I did was, speak to stakeholders across the state. And the question I asked them is, what do you consider to be best practices in a training program that trains CHWPRs in our state to serve our communities? What I heard from the stakeholders is what's compiled and has become this best practices framework. So to begin with, what I heard in my research was that CHWPR training programs across the state in California,
takes the diversity of different approaches to training, because they're training different participants, the purpose of the training is different, the organizational and the community needs are different, and so on. And so all these different approaches, they serve specific purposes, and they all hold value to the participants and to the field. However, what I also heard was that despite these differences, there are best practices that are common across these training programs. What this means is that for anyone looking to design, set up, or improve their training programs, no matter which communities you're serving, who your participants are, there are a certain set of things that the field feels are good practices that would be good to follow. And so this is what is summarized in this best practices framework that was shared with you all as a pre-read. So what you see on the right side of the slide is the categories into which these best practices have been organized into. So I'm going to quickly walk through them, and then I'm going to share some highlights from a few of these categories so you get a sense for the kinds of information that's included in the best practices framework. So starting at the top, training philosophy and methodology. In this category, the best practices describes what approach and philosophy training programs are using to design their training, design CHWPR training. Second category is core competencies, and this includes the specific topics that is recommended to be included in a good CHWPR training program. Third, training structure. This covers how long these trainings are, what it includes, things like field work, specialty training, and so on. The fourth category is training program transparency, and this is about what information is good for training programs to share transparently so that aspiring participants can make informed choices about which training program to participate in and what to expect in the training program itself. The fifth category is training instructor qualifications. So what should we look for in an instructor to make them good instructors of CHWPR trainings? The sixth category is training format. And so this is about when to use in-person training versus virtual training, when to use synchronous methods of training versus asynchronous methods of training, and so on. The seventh category is training participant assessment. So this is how do you assess that a participant has understood what you're trying to convey to them and can in fact integrate it into their work. The eighth is about enrollment requirements. So what should programs require participants to have or not require them to have to qualify to enroll in the training? The ninth category is training fees and costs. So this is how to think about how much to charge for the training. 10th category, training program evaluation. This is, like everything else, a really important one for how training programs should be constantly looking to understand if their training is meeting the needs of participants and how they can continue to improve so that they can better meet the needs of their participants. The 11th category, training organization credibility and qualifications. So this is what qualification should we be looking for in organizations who want to offer CHWPR training in California? And then finally, other good practices. These are things that didn't fit into any of the other 11 categories. It includes things like how to keep alumni of the training connected after training, how to collaborate across training programs, and so on. Next slide, please. So now I'm going to share just some highlights across some of these categories for what I heard should be best practices. So again, this is not comprehensive. We don't have time to share comprehensively everything in the document, but you have the pre-read. There is a draft. HCI will be publishing the final version in the coming months. So the first category, as I mentioned, is training philosophy and methodology. So what I heard from stakeholders as being best practice in this is that good CHWPR training programs should leverage the experience of CHWPR participants. They should acknowledge, honor, lift up, and really build on the lived experience, the skills, the knowledge, and the wisdom that CHWPR participants bring into the training. It is not just what the instructors share, but actually using the knowledge and wisdom in the room to enhance the training program. The second category of core competencies here, best practice, is that training programs align their training curriculum to cover all the 11 core skills that are included in the National C3 Council's list of competencies. Now, the depth to which each of these 11 competencies are covered should really depend on the need of the communities being served. The third category of training structure, best practice seems to be to offer at least 80 hours of training for CHW PRs to acquire a certificate of completion. This should include field work, but could also include specialty training based on the needs of the communities being served. The fourth category, training program transparency. Best practice calls for training programs to clearly state what content is being covered in the training, which employer settings and roles the training prepares its graduates for, so that CHW PRs, again, can make informed choices about which training programs that they enroll for. The fifth category around training instructor qualifications. Best practice is to have trainings to be led or co-led by experienced CHW PRs with relevant lived experience. Now, they can be paired up with other trainers or faculty members, but having an active CHW PR as part of the instruction team is really seen as being best practice. The sixth category around training format. So what I heard is that best practice here is to deliver some part of the training in person and some part of it virtually. Now, in-person training allows instructors to assess how well CHW PRs are understanding and integrating the training. And if you can't see them in person, it's really hard to know how well they're integrating it. On the other hand, virtual training is also really important because it keeps training accessible for those who may not be able to join in person for the entire duration of the training. So some of the things that good training programs seem to do is have weekday programs virtually and then weekend programs in person. Virtual training, I heard, is also really important because it builds CHWPR's capability to deliver services virtually. And this is increasingly common, whether CHWPR are doing virtual outreach or if they're doing care coordination on the phone, they have to be able to use digital tools to serve their communities well. The eighth category around training enrollment requirements. Here, stakeholders feel that good training programs keep enrollment requirements really to a minimum to ensure that the program is accessible to all CHWPR who want to join the training. For example, not requiring a high school diploma or GED, not requiring English language proficiency, etc., all help to keep the training program accessible. The ninth category around training fees and costs. Here, good training programs try to keep their cost to participate free or as close to free as possible by offering scholarships, textbooks on loan, etc. And really for the same reason, to keep training program accessible to all aspiring CHWPRs. The 11th category around training organization credibility and qualifications. What I heard from stakeholders is that given the community-rooted nature of the CHWPR profession, best practice really suggests that any organization wanting to offer training in the state of California be rooted in the communities that they're looking to serve. And this can include being located in the communities being served. It can include having deep relationships with them. And definitely having a track record of having offered CHWPR trainings should be, qualification for offering it in the state. So what I've shared here is just a sample of the kind of information that's included in the best practice framework. Encourage everyone to review the pre-read document. Again, as I said, HCI will be publishing the final version in the coming months. We hope these best practices are helpful to training programs who are looking for guidance in designing good programs and improving their programs to best serve your communities. Thank you. And now I'll pass it back to Libby to take us to the next slide.
Thank you so much, Lalitha and Joe, and thank you to you and to the members of the advisory group and everyone you spoke with who helped us shape this framework. I'll be really brief, just going to share some of our next steps. So we're very excited to be publishing the best practices framework, as well as a full report that kind of has all the background research and findings that went into building the framework. We'll be publishing both of those early summer, so look for those in the next month or two. And then we're also sort of working on a dissemination campaign to make sure folks know that this resource is out there. So we plan to do potentially some webinars, presentations in the community as requested, and we're working with our advisory work group just to sort of shape our dissemination strategy. On the next slide, we share our contact information. So we have a small but mighty CHW PR team that supports this work. If you have questions, if you have feedback, you can always reach out to us at the email address listed here. Just want to appreciate that team. We have Chinyelu, Mel, and Jerry on the line today, possibly others. Just appreciation for my team, for the work they do, for the passion they bring to the work, and also for the partnership from all of you who have helped us get here. And I think that's it for my piece. I will hand it back to Health Leads, who's actually going to share a little bit more about Pillar 2 from our framework.
Awesome. Thank you, Libby. Before jumping into Pillar 2, we just want to take a few minutes to have you all complete a brief poll on the best practices framework presentation that you just heard. So it should be up on the screen now. All right. All right, great. Next slide, please. All right, and I'll be providing an update on Pillar 2, which is dedicated to investing in the CHWPR workforce across California to ensure these vital healthcare professionals have the support and infrastructure they need to thrive. This pillar focuses on strengthening the organizations and systems that sustain these roles, ensuring their long-term stability and growth. As the California Healthcare Foundation transitions leadership of the Amplifying Impact Initiative, HCI has partnered with Health Leads to carry this workforce investment work forward in the next phase. Health Leads will be serving as the lead agency, supporting organizations through subcontracts aimed at enhancing workforce sustainability and building organizational capacity through direct support services and strategic infrastructure investments. Next slide, please. In order to award the subcontracts, we released a request for proposals this past March to find qualified organizations capable of implementing initiatives that enhance workforce sustainability and strengthen organizational capacity. This opportunity is structured as a contract because the scope of work requires defined deliverables, performance expectations, and ongoing coordination that align more closely with contractual agreements rather than grant making. This structure allows us to ensure consistency, accountability, and timely implementation across all awardees. Next slide, please. The interest in this program was overwhelming, with 417 applications received. Our performance period for these subcontracts runs from May 2026 to November 2027, with awards up to $250,000. We require that at least 50% of all the funding be dedicated directly to workforce support services. While eligibility was broad, we prioritized community-based organizations with deep community trust and equity-focused programming. Next slide, please. Ultimately, 25 organizations were selected for subcontracts, and we are currently executing those subcontracts and gearing up for onboarding in June. The vast majority of subcontractors are nonprofit, community-based organizations. Geographically, we have strong representation across the state, with nearly 40% of the cohort served in the Greater Bay Area, followed by Southern California at 21.2%, and significant representation in Central Coast, San Joaquin Valley, and Sacramento. Next slide, please. Our goal with Pillar 2 is to ensure that workforce investments amplify the reach of community health workers to serve diverse and historically underserved populations across California. These tables show the populations of focus served by the 25 organizations selected for subcontracts. 84% of organizations serve Hispanic, Latinx, and Spanish origin populations, while 60% serve Black, African American communities, and people with disabilities. Our key populations of focus also include justice-involved individuals, Indigenous communities, and rural regions. I'll just keep this up for a second. So folks can see the data. All right. Next slide, please. Okay, so that concludes my update for Pillar 2 and our ongoing work investing in the CHW PR workforce. As I've discussed, these efforts are centered on providing the contractual support and infrastructure necessary to enhance workforce sustainability and strengthen organizational capacity. With 25 subcontracts awarded to a diverse cohort of organizations, we're supporting vital work across the state, from Northern Sierra region to Southern California. I want to ensure that I have plenty of time to address your thoughts and inquiries. So to facilitate our audience question and answer session, I will now turn it over to Jolie, founder and principal consultant of Community Health Synergies. The floor is yours, Joe.
Thank you so much, Kussy. Thank you so much, everyone, for your participation and high level of engagement in today's webinar. We are now going to begin our Q&A session. We'd like to share a kind reminder for folks to drop in their question in the Q&A function. The Q&A function allows us to see the questions very clearly, and if you can address your question to any particular speaker or entity, that'd be greatly appreciated. I think I'll just start with some of the earlier questions that came in related to your latest updates, Kussy. And I'm just curious, there are some questions around if there's any information on the awardees, if there's a list of organizations that were awarded. I'm curious if you can provide any insight or updates there.
Sure, because we're in the middle of the contracting process and not all 25 subcontracts are totally executed, we can't share those the name of awardees until after that process is complete. So there will be another webinar in July. So by then the subcontract should be executed, and it's going to be the fourth webinar and the last webinar in this series. And so hopefully we should be able to share those by then.
Thank you so much, Kussy. I just resolved several questions regarding that. And there's another important question that came through regarding this opportunity. Are there still openings for RFP requests?
No, unfortunately, the RFP closed about a month and a half ago.
Great, thank you so much. Okay. I'm going to read through the other questions, and just keep in mind for folks that have chatted in their questions in the Q&A box, our organizers today have provided written responses in the Q&A box. You'll see the open tab, the answers tab, and another tab there. And so please feel free to let us know if you'd like follow-up responses to those written responses. I'm going to turn it over to see if Lalitha can help provide a verbal response to one of the questions that came through. I think Lalitha, you may have already provided a written response. I think I just saw the resolution there, but I think the question around if there were any kind of training programs using advanced modules or skills, and in your research and your findings, what have you kind of found?
Yeah, I think what's included in the best practices was definitely dependent on the way I asked the question. So what I heard was that the specialty modules or advanced modules are typically used to meet specific needs in the community. So in a foundational training, there's only so much information or knowledge that can be shared or things that can be taught. For more specific things like, say, chronic disease, particular communities might have a higher incidence of diabetes, for example. So community health workers might need to know more about that particular condition than might be covered in a foundational training. So specialty training tends to cover topics like that. I didn't hear as much about setting folks up for career growth, although what folks did talk about was that the CHWPR training can set folks, CHWPRs up for further training, whether it's in the area of nursing or other career paths folks might choose to pursue. But within CHWPR trainings itself, advanced modules seem to be used to meet specific needs of communities.
Thank you, Lalitha. And I believe that was Hector who has asked that question. So Hector, hopefully that response was helpful. Thank you, Lalitha. There are a couple of questions around requirements for CHW training and certification, if there's national requirements or they're state specific. I'm happy to answer that live. To our latest knowledge, there are state specific kind of requirements. Some states do have requirements, some states don't. As we had mentioned earlier, California does not have a statewide certification approach. We'd like to, and there are some earlier questions, important questions around who can issue certificates of completion for CHW PRs. Currently, especially in the context of Medi-Cal billing, currently they can be issued by any organization in California, another state, as long as the curricula includes the demonstrated skills and or the practical training and the core competencies with field experience. So happy to drop in more information about the required qualifications. In the best practices framework, we also highlight, based on the research and interview findings and recommendations by training entities, that the trainings should cover the 11 core skills described in the National C3 Council's competencies. So I know that was commented and there was a recommendation for that. So I just want to provide that additional insight. So thank you so much to the folks who have asked these questions. I'm currently scanning other questions in the Q&A box, and there are a couple of questions related to perhaps I wonder if Libby, you might be open to sharing your thoughts on some of these questions around what might be some available funding opportunities through HCI focused on CHW training. Might there be workforce awards, CHW workforce awards? And there was an earlier comment and some questions emerging around how we can support specific kind of programs and collaborate with other departments that might be doing similar work. So kind of jumbling those questions thematically, but Libby, what are your kind of initial thoughts there?
I think the short answer is I wish the answer was yes. We don't have a lot of funding for CHW PR workforce right now. I'll just be really honest. It's important to be transparent. I mentioned earlier at one point we had pretty significant resources, upwards of about $250 million. As many of you probably know, if you track the state budget process, we've had a really tight budget over the last few years. Lots of funds were reverted. That includes our significant funding for CHW PR workforce. So what that left us with was about $14 million. We engaged our advisory group, which has gotten a lot of love in today's presentations. They've been amazing partners to us. We engaged that group to figure out what's the best way to use these $14 million. And that's the 3-pillar framework that we shared with you. So that's the extent of the funding we have now. It's possible. We in fact did, it does look like we're going to receive funding to extend Pillar 1. We didn't talk about Pillar 1 today. Pillar 1 is supporting the organizations that engage CHWs and promotores to support immigrant and mixed status families at this time with sort of bi-directional referral between legal services, health services, supporting those folks on continuity of healthcare, supporting those folks with their mental health needs during this time of uncertainty, and systemic discrimination and violence. So that work might extend and there may be additional opportunities there, but that's the only new funding I have to share at this point. And we're happy. Like I said, we shared our email address earlier if you want to track what we're doing in this space, because things happen and new money comes in. Please do email that address and we'll put you on our listserv for CHW PR related announcements.
Thank you so much, Libby. And I'm just dropping in the email and the Zoom chat box, chw@hki.ca.gov. So we certainly encourage folks to reach out to learn about, to learn more information or potential future opportunities. So thank you, Libby, for your thoughts. I'm going to pass it back to Lalitha. There's a really great and thoughtful question around, maybe in your research and interview findings, has there been any kind of conversation around creating a CHW career ladder through training. And I know we researched a lot about how there are different types of kind of programs that might promote advancement pathways, but what are your kind of thoughts and some things that you've learned around that?
Yeah, yeah, it's such a good question. And I have to say, it's something that is on everyone's mind. I did hear a lot about it. In this research, we didn't focus on the career ladder, so unfortunately, I don't have a lot to share. In this particular work, we just focused on the kind of foundational training for CHW to prepare a CHW PR to become a CHW to serve their communities, but not kind of what happens next. But I just want to say that it's definitely on everyone's mind. And I think, good training programs do try to think about how it can set their graduates up for pursuing whatever they might want to do next, But specifically, what that looks like seems to be different by community, and it's not something we looked at gathering information on.
Thank you, Lalitha. And Logan, I would love to turn it over to you because there was a mention about if the Resource Center may have included any of these resources around career advancement and any tools that may have kind of been uplifted. Could you share some initial thoughts there?
Sure. So we are, I think, especially interested in kind of highlighting training opportunities that allow CHW PRs to advance their career development through pursuing kind of developing advanced skills, kind of specialized training to work with specific populations of focus or to work in new settings. And so one of the resources that we'll publish within the next few weeks is a guide to some of those professional development and specialized training programs that are, I think, some are California based, some are national, but we just found that there was a tremendous amount out there. So there's, I think, some that get into some specific topics. So whether that's kind of advanced motivational interviewing or kind of specific areas of community need that CHW's PRs can pursue training in. There's a lot of training. I saw there was something in the chat about behavioral health. There's a ton of great training resources for specialty and professional development training in that space on chronic disease. I saw a question about heart disease, and I think there's a lot on specific different chronic conditions and on violence prevention. So stay tuned, more to come on that. And we hope those resources can be helpful to really link kind of organizational needs, areas of CHW PR interest with some of those specialty and professional development opportunities.
Thank you so much, Logan, for your insights. I'm gonna
So
give,
can I jump in here?
please go ahead,
I
Libby.
just want to build on, yeah, Logan, thanks for that information. And I did see a question on behavioral health. I think there's another tie-in here that I just wanted to share. So, folks may or may not know that HCI is also working on our Behavioral Health Services Act, BHSA training plan, the Workforce Education and Training Plan, also known as the WET plan. That is the strategic plan that will indicate how we intend to spend our BHSA funds that start flowing this year. Happy to share more context about that separately. I know this is not a behavioral health webinar. So really what I want to point out is that actually by listening to community and partners in that space, we've identified a real need to support career ladders and career advancement from non-licensed roles to licensed roles. So our CHW PRs, our peer counselors, our peer support specialists, our SUD counselors, how do we help those folks if they are interested develop their careers and advance towards, let's say, a career in social work or a career as a SUD counselor from a CHW. So we are going to be doing some work to kind of flesh out those career pathways and try to develop and fund programs that help folks do that. So for those who are interested specifically in behavioral health, just encourage you to track our work on the BHSA funding stream and through the WET plan. That plan is actually open for public comment through tomorrow. So if you'd like to give us your feedback, please look that up. And we, of course, are keeping CHW PRs who work in that space in mind.
Thank you so much, Libby. There are some questions that came through related to the CHW uh, provider, the CHW benefit provider manual, and if there have been any recent updates. We want to acknowledge that the provider manual has been updated very recently, as of this month, May 2026. And I think I want to just acknowledge Mary Ellen's comments and questions. There isn't a new APL, but the manual has been updated. And in that manual, the CHW minimum qualifications, the certificate pathway language is there. That's there available for everyone to view. It's specifically on pages 18 through 19. And yes, I'm going to drop in the link one more time to that provider manual. This is for folks who are interested becoming CHW supervising providers and to be able to bill for CHW services through Medi-Cal. And so just want to just clarify that. And so I'm going to resolve some of those questions. Yes, the CHW manual is specific to California. I want to recognize the out-of-state colleagues and leaders here learning more about California's work. So thank you so much for your comments and questions. Okay. And I'm going to ask if any of my colleagues would like to chime in based on the questions that are coming through in the Q&A box. I'm going to see if there's any themes here.
Joe, I did see a question about California rural health transformation that I'm happy to help answer.
That'd be great.
Yeah, so a great question here, I think, about how funding opportunities through California rural health transformation may benefit or support the CHW PR workforce. So again, for a little bit of context for those who may or may not know, California received our first year of potentially 5 years of funding under the Rural Health Transformation Initiative, a federal initiative by CMS. We received a notification of award for $233 million for this first year. That covers 3 components, one of which is workforce. But there are workforce pieces spread throughout the 3 because we know that in order to expand access to care in rural areas of California, we have to make sure there's a workforce to provide those services, to extend those services, and to meet people where they are. Part of our intention is to use some of those funds to support developing and expanding the CHW PR workforce in rural areas. That will be a focus for us in year 2. So there isn't anything in year 1 that's directly related to CHW PR, but we are standing up an advisory council for the Rural Health Transformation Program. Those meetings will be public. In that space, we will be talking about our intentions and our designs for future years of funding. So I'd encourage those who are interested to sort of track those public meetings, attend those public meetings, and help us think about what kinds of investments in year 2 and beyond would be most appropriate to support the development of the CHW PR workforce in rural California.
Thank you so much, Libby. And Geraldine in the Zoom chat provided the link for folks to learn more about the Rural Health Transformation Project. So please feel free to check that out. Okay. I'm currently resolving some of the questions that may likely have been answered, but if there are any additional questions, please feel free to share. There's a question around if there's an update on the SPA, the state plan amendment for G-code rates. And the answer to that question is not yet. There's not yet an update. The Department of Healthcare Services, DHCS, will likely provide that, announce that update when that state plan amendment is made available. So I'm going to resolve that. And I'm curious, perhaps we can take a couple more questions. I see a lot of important comments and a lot of great thoughts and recommendations. So thank you so much, everyone, for sharing. Perhaps, Libby, I'll turn this question back over to you. there's a question around if the funds include CHWPR supportive services for behavioral health. I know you were talking about behavioral health earlier, so just wanted to kind of get your thoughts there.
Yeah, so we actually have two funding streams related to behavioral health that will connect a little bit to the CHWPR workforce. The first is BH Connect, which again, like Cal RHT, is a federally funded program up to $1.9 billion for programs related to advancing and supporting the workforce, the behavioral health workforce that serves Medi-Cal members. We have scholarship and loan repayment opportunities in there that can be accessible for CHWPRs who are providing behavioral health, direct patient behavioral health services in qualified settings. So I encourage folks to take a look at that opportunity. And then the second, as I mentioned, is the sort of the strategic planning work that we're doing for BHSA, Behavioral Health Services Act. As part of that, we're going to focus, I think the most direct link is focusing on the career letters and career advancement piece. We're also going to be supporting education capacity expansion for other behavioral health focused roles. Again, sub counselors, peer support specialists, social workers. So folks who are interested in pursuing those careers who might be CHWPRs now, there will be scholarship opportunities available in addition to sort of the bridging and the career advancement pieces. And I'll just remind, so we are focused on the workforce piece at HCI, the sort of questions around direct service policy and how that relates to behavioral health supports and CHWs. Those are DHCS questions, and DHCS has separate BHSA components. So I just refer folks to them for those pieces.
Thank you very much, Libby, for all that helpful information. And in the chat box, folks will see that Geraldine dropped in one more link for today. Lots of great links, lots of great information. So there's a link to the BH Connect information. I'm starting to see a drop off in attendees, and in the chat box, folks are indicating that they have to leave. And so I think I'm going to wrap up Q&A and pass it over to Kussy. But right before I do that, can we give a round of applause to our panelists? Thank you to Libby from HCI, Logan from Center for Healthcare Strategies, Lalitha, our independent consultant, and Kussy and the entire Health Leads team. Oh, great. Lots of emojis are coming through. Great. So we hope we were able to answer as many of your questions, and we love all the input and recommendations and insights and the networking that has been happening in the chat box and through the Q&A. So we are so just happy to be in community with all of you and hope these updates have been very informative. With that said, I'm going to turn it over to our fabulous colleague, Kussy, to close us out.
All right. Thank you so much, Joe, and thank you to all the speakers. If the slides could be, the last slide could please be shared. So this is off script, but this is a new format of sharing dual slides. So especially for the folks listening in on the Spanish channel, we'd love to hear your feedback in the chat about this experience of having the dual slides in English and in Spanish. So we'd love to have your feedback. All right, so for next steps, we'd love for you all to take us a post-webinar survey if you have the opportunity to. We're going to have our last webinar in the webinar series, which is going to be happening on July 23rd. So, and that webinar is going to be focused on Amplifying Impact Initiative evaluation findings. One of our close partners, Bright Research Group, they've actually been the evaluators of a lot of the Amplifying Impact Initiative and the Community Health Worker Implementadores Capacity Building Collaborative in the past. And so they've been evaluating this work for the past 18 months. And so we'd love for you all to join us on July 23rd if you're available. And put the registration link in the chat if you'd love to, to hear more about the initiative and those findings. And if you have any questions, please feel free to reach out. My contact information is at the bottom of the slide. And again, please take the poll if you can. It should be up on the screen. Thank you. All right, so with that, I will close us out. And thank you all so much for being here. And have a wonderful kind of weekend. We're almost there, almost there. All right, take care, everyone.